Understanding Kaposi's sarcoma. Causes, signs, symptoms, and treatment. Kaposi's sarcoma, KS, is a rare cancer that develops from the cells that line blood vessels or lymphatic vessels. It often manifests as tumors or lesions on the skin or mucous membranes but can also affect internal organs. Named after Dr. Moritz Kaposi, who first described it in 1872, KS is associated with the human HERPESVI or US8, HHV8. Here's an in-depth look at its causes, signs, symptoms, and treatment. Causes. 1. Human HERPESVI or US8, HHV8. Primary cause. Infection with HHV8, also known as Kaposi's sarcoma-associated herpesvirus, KSHV, is necessary for developing KS. Transmission. HHV8 spreads through sexual contact, blood transfusion, organ transplantation, or from mother to child. 2. Immunosuppression. HIV, AIDS. KS is particularly prevalent in people with HIV, AIDS due to their weakened immune systems. Immunosuppressive therapy. People undergoing immunosuppressive treatment, such as organ transplant recipients, are also at increased risk. 3. Genetic predisposition. Ethnicity. Certain ethnic groups, such as Ashkenazi Jews and people from Mediterranean or African regions, are more susceptible. Types of Kaposi sarcoma. 1. Epidemic, AIDS-related, KS, most common in people with HIV, AIDS and linked to the severity of immune suppression. 2. Classic, Mediterranean, KS, typically affects older men of Mediterranean or Eastern European descent and progresses slowly. 3. Endemic, African, KS, found in African populations. It can occur in both children and adults and may be more aggressive. 4. Iatrogenic, transplant-associated, KS, occurs in individuals on immunosuppressive therapy following organ transplantation. Signs and symptoms. 1. Skin lesions. Appearance. Lesions can be purple, red, or brown and may appear as flat patches, raised nodules, or plaques. Location. Commonly found on the legs, feet, face, mouth, or genital areas but can appear anywhere on the skin. Progression. Lesions can grow, merge, or ulcerate, causing discomfort or bleeding. 2. Mucosal lesions. Mouth. Lesions may develop on the palate, gums, or throat. Respiratory tract. Lesions in the respiratory tract can cause symptoms like cough, shortness of breath, or difficulty swallowing. 3. Internal lesions. Gastrointestinal tract. Lesions can develop in the digestive system, leading to symptoms such as abdominal pain, bleeding, or bowel obstruction. Lymph nodes. Swelling of lymph nodes can occur. Systemic symptoms. Fever, night sweats, and weight loss, more common in advanced disease or in those with severe immune suppression. Diagnosis. 1. Physical examination. Initial assessment involves examining skin lesions and evaluating symptoms. 2. Biopsy. A skin or tissue biopsy is performed to confirm the diagnosis by identifying characteristic KS cells in the presence of HHV8. 3. Imaging tests. X-rays or CT scans, to check for internal lesions. Endoscopy. For gastrointestinal involvement. 4. Laboratory tests. HIV testing. Important to determine if KS is associated with HIV, AIDS. Treatment. 1. Antiretroviral therapy. ART. For HIV, AIDS. ART is crucial in controlling HIV and can lead to regression of KS lesions by improving immune function. 2. Local treatments. Surgical excision. Small, localized lesions can be removed surgically. Cryotherapy. Freezing the lesions to destroy them. Laser therapy. Using lasers to remove or reduce lesions. Radiation therapy. Targeted radiation to shrink lesions, particularly for those causing significant symptoms or in sensitive areas. 3. Systemic treatments. Chemotherapy. Drugs such as liposomal doxorubicin or paclitaxel can be used for widespread or aggressive KS. Immunotherapy. Interferon alpha can boost the immune response against KS. Targeted therapy. Newer agents targeting specific pathways involved in KS are under investigation. 4. Supportive care. Pain management. Medications to manage pain or discomfort from lesions. Symptom relief. Addressing symptoms related to gastrointestinal or respiratory involvement. Prognosis. Depends on factors. Prognosis varies depending on the type of KS, extent of the disease, the patient's immune status, and response to treatment. HIV/AIDS association. In AIDS-related KS, the prognosis has improved significantly with effective ART, leading to better immune function and control of KS. Follow-up care. 1. Regular monitoring. Frequent follow-up appointments to monitor the response to treatment and check for recurrence. 2. Long-term management. Continued management of underlying conditions such as HIV, AIDS, or immune suppression is crucial for preventing KS recurrence. Kaposi's sarcoma requires a multidisciplinary approach, with treatment tailored to the type of KS, the patient's overall health, and the presence of underlying conditions. Early detection and appropriate management can significantly improve outcomes and quality of life for those affected.